Hello. If you have struggled with pelvic pain, pain with penetration, pain or inability to insert something like a tampon, or maybe you've been afraid to go get a pap exam, you may have pelvic floor dysfunction. And there are a variety of treatment options that may be available for you. And today I want to talk about one of them, which is dilators. So dilators or pelvic trainers are a graded set of tools that we may recommend for patients to use. And they have several purposes, but I'm going to talk about kind of the main two. Dilators can be helpful to decrease any tension in the pelvic floor muscles. They also are a really good option to help retrain the nervous system and the pelvic floor. Often what's happened is there's been a feedback loop that's developed. So basically, let's say something was inserted into the vagina and there was pain. The muscles might guard in response to that. And then the brain is going to be like, oh no, we don't like this. We want to make sure this doesn't happen again. And then the next time something goes to be inserted, the muscles are like, oh, right, we don't like this. They guard more. There's more pain. And we get this sort of feedback loop that develops. And we want to try to break that loop, which is where these dilators can be useful to do that. So one way I may have patients use dilators is to start with the smallest one, put lubricant on it, and then you would go and insert it into the vagina. And let's say you're able to insert it and there's no pain. Then as it's inserted, you would perform some movements. You would turn it, move it in and out, things like that. If you can do all of that without pain, you would move up to the next size and then repeat. You would put lubricant on it and you would insert it. If that's painful, then that's all you're going to do is just leave it in there, remove it, and repeat the next day as you build up in size. There's also no one size fits all approach. Some people can spend weeks on one size. Some people go up very quickly in sizes or may have to go down in size as they're working on their dilator protocol with their provider. Not everyone needs to be using dilators. So that's why it's important to work with a healthcare provider to determine if these are appropriate for you and to help you progress with the dilator protocol. Another thing to really keep in mind is consistency is key. Just like any other skill, you need to do this on a consistent basis. So as I tell patients, 1 minute is better than no minutes, and a few times a week is better than once a week. So in an ideal fantasy world, you would do these every single day for 10 to 15 minutes. We don't live in dream fantasy land. So again, if you can only do it for 1 minute, a couple times a week, I prefer that than once a week. So again, be consistent, but more importantly, find a pelvic floor specialist who can work with you on achieving your goals, and that may include dilators.